I would like to request on stage Mr. Hirender Singh, CEO, Hirender Medicare and Solution Private Limited. So please come on the stage, sir. Then we would like to call Dr. Sunil Khetarpal, Director of Association of Healthcare Providers, AHPI. Dr. Sachin Bajaj, Founder Director, Ujla Cygnus Hospital. So please come on the dais. Mr. Tantradas Gupta, Business Head, HOD and Senior Director, India and SARC Samsung Health and Medical Equipments. Mr. Ashish Rohila, Executive Vice President of Ossphere IVF Services Private Limited. And I would also request everybody to please be more, I want this session to be long, but then we are running out of time. So please take care of that.
Thank you. Good afternoon, everybody. We are beginning late, so we'll try to keep the session very tight. I'll request the panelists to kindly restrict their answers to 3 minutes. And instead of going for 2 questions, we'll go for 1 question each to begin with. Right? So, or we can do that. Hanji. So the VUCA is a very critical part in any life. Healthcare gets half of its business through VUCA. If the patient were not to be hit by VUCA, he wouldn't really come to a hospital. In this session, we're talking about how to look forward, how to grow, what are the strategic initiatives that we need to take to grow and ensure that VUCA does not impact or minimally impact our business. I'll start with Dr. Sachin Bajaj. He has to rush to a meeting. Dr. Sachin Bajaj is a legendary person in the healthcare delivery space. He has taken the difficult path, gone out to the areas where healthcare cannot reach easily and set up a very successful set of hospitals there. Since we don't have time, I'm not going into details of his introduction. Dr. Bajaj, my first question to you, in view of VUCA, what are the key success factors for deepening existing healthcare markets amid regulatory and policy volatility, especially in the small towns, rural settings, and economically constrained environments that you have chosen to operate in? It was very easy for you to operate in the metro. You chose to go there. Thank you.
Thank you very much, sir. Everybody has their own acronyms for VUCA. We heard the vitals usually change anytime. For me today, I think it's very unpredictable conference agenda. Really sorry, but I'll have to run in between. I have a meeting out of station in Agra planned. So I planned it very carefully. But as we all know, man proposes and God disposes. So I had planned it to that point that, I will be free at this time from here, then I'll go there and then do that. I agree. So really sorry about having to run out in between, and very sorry for pressuring you to do 1 question instead of 2. So what we do is we run hospitals in small towns, rural areas, and in communities that don't have access. We have 28 hospitals spread across 6 states of North India. And we are in towns like Kaithal, Rewari, Sitarganj, Kashipur. We are also in Srinagar, which has different kinds of issues, but still again access issues a lot. So we go to communities that usually do not have anywhere to go to in the golden hour. In the golden hour, if you are having a heart attack, if you have 100 crore rupees in your pocket and you are in a town like Sitarganj, there's nothing you can do about it, right? Because there's no cath lab, there's no cardiologist. If you have a head injury or an accident, there's no neurosurgeon there. So that is the community that we try to serve. Of course, these are financially challenged communities as well. And in this volatile environment, there are a lot of volatilities happening and uncertainties. One is the policy from the government. Sometimes you have Ayushman coming in. Sometimes they will say, like a week ago, the government said that you cannot do phaco surgeries for cataract under Ayushman, you cannot do hysterectomies under Ayushman. So they keep going and changing the environment, but also there are social uncertainties happening. There's a lot of volatility in the social environment in those towns. So This is where trust, I think, is the most important currency that plays a role. If you can build trust in the community, half of your job is already done before you've even gone out. So we do a lot of community outreach programs. They are called Sehat Chopals for us. So we go village to village, screening people, talking to people, making them aware about diseases, telling them to improve their healthcare, seeking behavior, guiding them about the various government schemes that are available for them, how they can get, lesser out of pocket expense for their healthcare management. So a lot of that, if once you build trust in the community, it leads to a lot of adherence, a lot of awareness, and a lot of referrals as well. The community feels that, they are not just treating us when we are sick, but they come to talk to us when we are healthy also for preventive things, and we try and tell them how to keep out of hospital. Second, I think the important thing to do is be very, very hyper local in your thinking. What will work in Western UP will not really work in Jammu, or not work in Srinagar, or not work in Uttarakhand. So you have to be very hyper local and think. You cannot sit out of Delhi and think for 40 hospitals altogether. So I don't know if you can understand this thing. Our investors certainly couldn't. So we don't do a lot of integrated cancer. We started with, because cancer is a very expensive proposition for us. We do very, very low cost healthcare. But we understood that it was not only poor physical outcomes that were destroying these communities. As I said, a heart attack and no cardiologist there, a head injury and no neurosurgeon there. It is also a poor financial outcome that's hitting these communities very hard. Because as Sir said in the opening lecture also, more than 60 million people in India are slipping below the poverty line just because of a single healthcare shock. And Onco is one of these departments where usually the big city hospitals that have the linear accelerators, etc., do not accept these government schemes like ESI or Ayushman. If you are unlucky enough to have cancer in a small town, you go to a big city, they will not accept your government card. You stay there for 4 to 6 weeks for the first session of radiotherapy. Your family stays there with you. Usually will lead to selling of a lot of assets. So when we thought about starting cancer integrated program, of all the places, we said we'll set up our first integrated cancer hospital with a bunker, with 2 linear accelerators, PET scan, etc. Not in Delhi or not in a big city, in a town called Haldwani. Our investors were quite zapped, like what are you speaking about? But that is what I said, if you are really hyper local in your thinking and you know exactly what's happening and you're not sitting in Delhi and making the plans, you know that Haldwani caters to not just the entire Kumaon region but also Nepal behind that. And they all climb down to Haldwani to access healthcare, which is a huge hub of people, and when they cannot access healthcare, they go on forward to Bareilly or Meerut or come to Delhi. So if you can stop them there, there's a huge business waiting for you there, and this is how you build for this. Third, I think, is partnership with the public sector. I mean, people usually in healthcare, in private hospitals, in corporate hospitals will say that we are here despite the public sector, despite the government, we are, thriving despite government policies. But to work in a VUCA environment, I think you need to partner with the government and make sure that you are very, very aligned to what the government thought process is. And last, I think, as Chibbat Saab closed with, data is the new oil. I think you need to make sure that you squeeze the data enough. Right now, what we have from data is only information. That, you are getting informed about all these things about you, but can you use this data and use this information to develop insight into what exactly is happening, make it very simple, because if you are running a large business, you can't keep scanning data all the time. You need to be a bit like, in Matrix, I don't know if you've seen it, there was this guy Tank who had all these numbers flowing down, but in those numbers you could see there is a door here, there is a pathway here, only he could decipher all those numbers. So if you can have someone like that sitting with you, deciphering all those numbers and telling you there's a pathway on this side, there's a door there, and from that insight that this guy is giving you, then you develop the foresight to go and estimate, not the astrology part that we were speaking about earlier, but you need to be at least 2 steps ahead of the rest of the market to make sure that you survive and thrive in very economically challenged environments. Thank you very much for this.
Thank you, Dr. Sushin. That was quite insightful. I'll now get to Mr. Tantra Das Gupta, who's the head of Samsung Health and Medical Equipments in India. MedTech Center is a very critical area, Mr. Das Gupta. Sorry, I cut short the introduction. So, I'll directly go to the second question, which is more critical, the second that we had reserved for you.
Okay.
What framework or tools have you found effective in managing risk and building resilience in healthcare businesses, specifically in the highly competitive medtech sector? Thank you.
So now it's good afternoon.
3 minutes.
3 minutes, okay. Because the theme is VUCA. So let us understand that which component has been grossly affected by VUCA. This is the human beings. So I will start with 2020, when there was a risk mitigation factor needs to be addressed, resilience needs to be seen. And the worst affected component was human being, be it an employee of an organization, medtech organization, be it the patients or the healthcare providers. So I will start that how do we engage the employees, the doctors, because we are working day in, day out with the doctors, and how the business has grown from that scenario. So suddenly after Janta curfew, if I remember, everything got closed. And there was an uncertainty, there was an ambiguity, there was a complexity, and obviously this is leading to a volatility. So what we have done, we have in touch with the doctors, and they also don't know what to happen, because we are particularly dealing with radiologists, and there was a sense of uncertainty everywhere. So then we decided how to keep our employees to engage, because it is the human resource which dominates the business, not a technology. Technology comes later. First component is human being. And in that scenario, our first challenge was to keep them together, and they should not get into depression, they should not get into uncertainty. Hence, we form a virtual office or a classroom, anything, or a boardroom, and we keep in touch with each and every one. And then we have hired an online platform for 200 doctors, and we have requested one of the doctor to moderate a session, similar session, but it was virtual. And he got an immense response. Immediately, within 5 to 10 minutes, all the slots were filled up, and we started getting calls, every one of us. And then we realized, no, we have to increase the size of the platform. So we have taken a 3,000 platform. But what is important there was, we keep everyone engaged, not only our own employees, but also our customers. And in some cases, the customer's customer, that is the patient. So you opened up. And the result is, yes, the data. We got a lot of data, tangible data, from where we have found out that what are the problem statement and how the business needs to be grown. And the first and foremost, what we have accomplished, that we have kept our team intact. Nobody faced uncertainty because we are talking to each other, everybody was engaged. And you can ask me that how? I can give you the straight away numbers. We have done 68 webinars in that year, and all our employees, even the doctors which we are in touch with them, they are also engaged, because it was, in some days it was 2 to 3 webinars which are getting conducted, and the response was enormous. That's how we build up a platform to grow the business. And now if you can ask me that what is the number, we were on 28-29 million in 2019. In 21, we grew to 50 million.
Wonderful.
So that's
congratulations. Wonderful.
Thank you.
Thank you, Mr. Das Gupta. Before I come on to the bigger canvas, I'll go to a focused canvas. I'll go to Mr. Ashish Rohela, who heads Oosphere, an IVF hospital. So I'm blending both your questions together, since we are running out of time. How would you deploy short-term agility for long-term sustainability and transform your single specialty hospitals due to VUCA and not be hit by it? How would you derive it as a business tool instead of an adversity?
Right. So, starting from scratch, like I'm representing Usphere IVF Services, we are kind of a consultant who work in the fertility space and who works with gynecologists and advise them how to open IVF center. It's a new domain which is getting developed. So there are a lot of models which needs to build. So I'm representing them right now. My perspective, our perspective is on the agility and given the VUCA scenarios is going through two directions. One is like how we can do that from the strategic perspective, and another one is like how the government can play the role, because they are the biggest drivers. So we have to understand the whole framework, that when we need to work on the short-term agility and when we have to go for the long-term sustainability, we have to evolve over a period of time. There are always the challenges which is coming in the industry, but how we can handle that. So the short-term strategy is like what are the current scenarios, fertility space, like a lot of, it's a 8,000 crore market and almost 3,000 IVF center right now in India, and which is expected to grow almost 4 times in next 2 years. So that is how the space like it is growing, and for long-term sustainability, a lot of being a consultant, like a lot of roles are coming into the picture, where what are the challenges from the regulatory perspective, economic perspective, and how the external atmosphere create a problem and the challenges in that. So definitely a lot more to evolve, and we are building that model and we are working on that.
Thank you, Mr. Rohila. Now I'll come to Dr. Sunil Khetarpal. He is heading the Association of Healthcare Providers. He has a very long pro forma. He has done a lot with his life, but since we don't have time, I'll limit myself to his first question, and I'll go to your second question first. We will train the leaders later. In the context of Indian healthcare, what are the key pillars of strategic depth that AHPI member hospitals should focus on to ensure long-term business sustainability in a VUCA environment? Could you share some practical imperatives or priorities that you believe are critical for navigating uncertainty and building resilience? 3 minutes.
Thank you, Harinder. I will be quick, short, sweet, and crisp. AHPI, I think as all of you know, is the Association of Healthcare Providers India. We are a not-for-profit organization, and we are mainly into, we represent majority of private hospitals in the country, with 20,000 plus hospitals as our members. And we are into policy advocacy with the government, with the regulators, with the stakeholders, and we are also into capacity building, skilling, training, and many other collaborations. So I think a very important question, because we have such a large presence across the country. We have created 20 state chapters. Dr. Sachin will vouch for us, and he's part of us, of course. I think many of you who are sitting here are part of us. So AHPI, having its presence across the country, and our actual motto of AHPI is to educate our members, right? We educate our members. So this is very important in a VUCA environment. VUCA is now going to be a buzzword. I mean, whosoever has coined this term VUCA is something which is actually, which has been there, which is there, and which will remain always, right? So most important aspect for AHPI to thrive on the VUCA environment, that their members, what they should have, first of all, the hospital, because we are largely, I represent hospitals. So first thing is that they should have that clinical excellence and quality care, very important. Because what matters in healthcare is outcome. If you see the definition of healthcare quality, ultimately it is outcome, right? So clinical excellence and quality care, having clinical pathways, right, and following them, and quality care, accreditation, certification, which will streamline your processes, right? So you will do the things right. It will sort out a lot of issues once you have, and we actually encourage our members to go for these accreditations and certifications. Our Director General, Dr. Girdhar Gyani, being the quality guru of the country, who was the Secretary General, Quality Council of India, and the first CEO of NABH, who was responsible to bring NABH to this country. And just to inform you, yesterday, NABH completed 20 years. So it is 20 years of NABH in our country.
2 decades of quality.
Mr. Anil Johri is here. He was the CEO. He worked under Dr. Girdhar Gyani. So I'm still working under him. So you have lost that advantage. So yeah. So he was the CEO NABCP, and I think things, quality care accreditation, something which the hospitals need to implement. And secondly, important aspect of this VUCA for our hospitals to thrive in the VUCA environment is to have a effective leadership. Leadership is very important.
Thank you.
Ultimately, everything comes from the leadership.
Absolutely.
And employee, of course, well-being is important. They are taking care of their mental
Thank
health issues. And of course, another thing is that agility. We have to continuously train our people to be agile, to be adaptable, because it is the VUCA, if you say C is complexity, but complexity is mainly because of competition. And it is the third element, VUCA. We use C, but I will give C as on the top because it is so complex. Healthcare is so complex. It is, the more the competitive market is, the more the complexity is. Yesterday, 2 days back, I got up and saw the news, Amazon entering into diagnostic market. Dr. Lal and Dr. Gaur, I think Dr. Gaur is sitting here, I don't know. Yes. So, Amazon entering into, and Flipkart, Blinkit entering into ambulance market, having ambulances in Gurgaon. Amazon entering into, tomorrow Uber will go into ambulance market, Ola will go into, they have all the vehicles, 2-wheeler, 3-wheeler, 4-wheeler, tomorrow they will come for the ambulance market. So it is a competitive world. So you have to be resilient, you have to be able to cope up with this environment. You have to teach your team, you have to train your team to be resilient, to cope up, to be ready, to keep their eyes and ears wide open. What is happening around you? And continuously have proper communication, coordination among the team, external communication, internal communication. Go into the market, see what is happening. So I think even you may add your specialty, you may like to look for some diverse revenue sources. Because it's market survey you do, you see that some of the specialties which you think that is doing well. Like he said, cancer is not their cup of tea. No, he's right, because he is catering to the low, socio-economic group people, and he's doing very well. I'm telling you, his model is a great model. So it is the need, the demand, how you adapt, how you thrive. Ultimately, I think having all these strategic pillars, of course, then only you can survive. Sustainability will come.
Absolutely. Thank you
so much.
Thank you, Dr. Khetapal. Before I open the question to the audience for 1 or 2 questions, I'll quickly come to Dr. Bajaj. We just talked of cancer. My business was hit with massive VUCA today. A prostate cancer patient came from Zimbabwe, was supposed to start radiation Monday. He passed away in his bed last night because of huge myocardial infarction. By the time we could rush him to the hospital that we had brought him to, he had passed away. Now, this is VUCA that the healthcare delivery organizations face very frequently. Now, this may sound cruel, but how do we transform into a business development tool for a hospital or a chain of hospitals rather than letting it bring us down, destroy that relationship that you killed our patient? Doctor.
Yeah, I think, as I said, building trust is the most important part, and building trust takes a lot of time. Breaking trust is very, very quick. To build your name, you need to keep really working hard. Dr. Pratap Reddy has worked hard all his life to make a name for himself, right? Gangaram Hospital has been there forever and they've made a name for themselves. So if a patient passes away unexpectedly any of these hospitals, usually the patient's attendant will say, oh, it's our bad luck. We had come to the best place, but you know, it's God's will. But if a hospital doesn't have a good reputation, if a person as a doctor doesn't have a good reputation, and this suddenly happens, the patients will have a lot of mistrust in their mind that what have you done to our patient? The patient came walking in, what happened to him suddenly, right? So this is why building trust as your sole currency instead of working on money, etc., is something that we healthcare providers have to focus on all the time. If you do good work, sooner or later, this will get built.
Thank you, Dr. Bajaj. Very succinctly put, very succinctly. He talked of trust and engagement. Sorry, I'll ask one more question. He talked of trust and engagement. So, how do you see consumer trust and engagement evolving in high-risk environment, healthcare delivery, where your medtech is playing a very key role? So, while you may not be in stents, I deploy a stent and that patient dies of a kidney failure. Right? So, how do you bring trust that no, stent was not involved? This is not just an example. Thank you.
Thank you for asking a very pertinent question, because the medtech device has got a unique characteristics in the business. They are not only working with the doctors, but also the patients, means the customer's customer. So there, the trust has to be two-pronged strategy. It will be with the doctors and also with the patient. Like you have taken an example of a stent. So there lies the crux, that whether the stent is compatible, biocompatible, those factors need to be assessed very stringently. You cannot compromise today. Today what is happening, it is not about, because I just heard in the earlier panel, they are talking of geopolitics. Here the geopolitics is also playing a big role. Because are we compromising the quality because of price? Are we introducing the latest technology in our country, or we are compromising on it? Are we looking for a cheaper option, or we are going to give a wholesome care to the patient by offering the best quality products? That needs to be looked upon. And this is not only the responsibility of corporate hospitals, but also the government. The government should act, and government should act judiciously. Another point I just want to touch upon, because you asked these questions to me. We need to be very careful that our demographic data is not getting into the hands of nefarious countries. Because we have faced COVID, and COVID, there are a lot of research has been performed and found out that the virus, the tail portion particularly, the amino acid sequence is a synthetic one. So let's be very careful, because we have the largest amount of working population. The world is looking towards it. The population of our country is going to other foreign countries and serving those nations. So we should not risk our population. Our government, the healthcare professionals, the medtech, the industry person, and also the patients as a whole, or the society as a whole, we should be vigilant about it. Thank you.
Thank you, Dr. Thank you, Mr. Dasgupta. We have time for two questions from the audience. Yes, Dr. Varun.
Thank you very much for the insightful session, sir. I have a question for Mr. Dasgupta. Thank you very much for the insightful session, sir. I have a question for Mr. Dasgupta. While you were just speaking, you were speaking about integrating the best technology for patient care. So my question to you and to everybody is there a problem statement, or are we creating one?
Yeah, it is a problem statement, obviously, for a country like ours.
Yeah, let me finish, sir. My question is, the results were similar 2 days ago. The results are similar today when we incorporate the latest technology. We are identifying the problem statements which maybe never existed. We are giving it to market forces which are promoted by the West. The new technologies are coming in. Are we doubting our own decisions which we took 2 days ago?
We are not doubting our own decisions, because I firmly believe we can produce the most advanced technologies. Today, world is looking towards us. If you go to any leading organization, technological organization, you will find 60% of Indian scientists, engineers are working there. So why can't we stop that and bring those scientists or engineers in our country and engage them? Engagement is the key. You name any medical, because I am from a medtech industry, you name any medtech company, the leading ones, you will find most of the engineers, most of the scientists are from our country. And it's not only in West, but also the Southeast Asian countries you have.
We'll limit to one question.
Yeah,
Thank you.
We have a lot of engineers working.
Sorry, Dr. Varun.
Yeah. So we are not compromising, because in medtech, in medical industry, in healthcare, compromising the technology is a sin, because we are dealing with lives. If something happens, the life is not going to come back. So we have to be very, very vigilant about this. It's not about India or outside. It is about the world as a whole. It is a global village, and the patients belongs to the world, not to a single country. Today, if you see, when you are talking about AI and digital health, we are talking about interoperability. Why you are talking about interoperability? We are not going to limit ourselves to a one country, not even our patients, because I am traveling outside, you are traveling outside. If something happens to you, then who is going to take care of you? So the quality has to be maintained globally. It is not a responsibility of a single country. We should work together. Today, why the multinationals are here? Why are they in other countries?
That's correct. Thank you very much. We have time for one more question from the audience to any of the panelists here. Would anybody want to ask any question? Okay. I see that Mr. Rohila wants to add something to it. Please.
Yeah, absolutely right. I want to say that we have to, change is like, we have to understand change is an ultimate truth. It's going to happen, right? And then how we are going to adapt to those changes. So whatever the informations, whatever the work we are doing in the clinical work or maybe the healthcare segment technologies right now is what we are doing right now, but there are a lot of changes coming when we see technologies coming in. So say for example, let me give one example of technology. Last year we were using Google search and we are doing Google search and all that, and then how the information was coming in the number of links. Now since AI come into the picture, it is giving us a consolidated summary. So when technology is adapting with the reference to what is happening right now, is going to provide us more efficiency, more control, more robustness in our systems. So that is going to happen, and then how we leverage that is up to us. So we have to embrace the changes which are coming into the system.
Thank you, Mr. Rohila. That was quite insightful and helpful. I'll come back to Dr. Khetarpal, an ocean of experience. Would you want to say something about how to transform VUCA into a growth tool and make strategic initiatives, take strategic initiatives? Yes, thank you.
I think, you know, there are some practical imperatives when you want to really stay or sustain in the VUCA environment. First thing is develop a robust strategic plan. You need to clearly outline your goals and objectives. Number two, monitor and adopt a change. You have to adopt to changing market conditions. You know, market conditions are very dynamic, so you need to have that. Third is the foster a culture of innovation, embrace technology, foster a culture of innovation. This is the third point. Fourth point is prioritize your employee well-being. I am emphasizing, please. He also mentioned about their human resource. Employee well-being is important. Their mental health, acquisition of talent, retaining the talent, and taking care of their well-being. Simply, that's all. Then comes your leveraging their data analytics. Today, we are not, as Dr. Sachin Bajaj was mentioning, data is there. This is there to guide you. You know, you have a lot of information. But data analytics to get you to the decision, what you say that clinical, you know, how you clinical decision support, and all these are, we make you to take decisions taking. Your you know, clinical decision, what you say that, these things, they make you to take decisions better, clinical decisions better, data-driven decisions. ultimately. That's very important because you need to have data analytics, clinical informatics, and take data to lead you to data-driven decisions. That to improve operational efficiency, outcome, and patient satisfaction, which is what we all are here for. Ultimately, it should lead to the patient delight, patient satisfaction. Thank you.
Thank you, Dr. Kedarpal. So to sum it up, VUCA hits every industry. It hits healthcare with three times more intensity and savagery. You have a patient that comes from care for cancer, and even before the treatment starts, the poor guy dies of cardiac arrest. As Dr. Bajaj, who just left, had to go to Meerut, as he said, reinforcing, as he also said, reinforcing trust in your intentions, in your commitment to delivering the treatment. Being transparent is very important because VUCA, you either take VUCA as a tool to bring down your business, or you deploy VUCA to grow it further. And since VUCA would continue happening, on the risk of repeating myself, since VUCA would continue hitting healthcare more and more, it's very important to reinforce the trust and be as transparent as possible. With these words, thank you. I'll close this session now. Thank you for your time and attention.
Thank you so much for the knowledge that you have shared, sir. And with that, let's take a picture first. Now I would request you all to please be on the stage because we still have to felicitate you. So I would like to call Mr. Manish Astogli and Dr. Madan Gopal to please come on the dais to felicitate Mr. Hirinder Singh. Can we have a round of applause, please? Dr. Sunil Khetarpal. Mr. Tantradas Gupta. Mr. Ashish Rohila.